Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A study published in the American Journal of Respiratory and Critical Care Medicine in March of 2019 showed that higher omega-3 fat intake and lower omega-6 fat intake may help to protect children against asthma attacks. So the study included 135 children ages 5 to 12 years old who had asthma. Now, roughly a third of them had mild asthma, a third had moderate asthma, and a third had more severe asthma. Now, their diet, daily asthma symptoms, and asthma medication use were assessed for 1 week at enrollment, and then again at 3 months, and then again at 6 months. So it was a 6-month study. The study showed that children with higher levels of omega-3 fats in their diet had less severe asthma and fewer symptoms in response to exposure to higher levels of indoor particulate air pollution, whereas children with higher levels of omega-6 fats in their diets had more severe asthma and more symptoms in response to exposure to higher levels of indoor particulate matter. So during the same period, the investigators measured 2 types of indoor particulate pollution. When inhaled, these large particles are deposited along the airways. The study also showed that higher levels of omega-6 fats in the children's diet correlated with higher percentages of neutrophils. So neutrophils are white blood cells that produce inflammation when they are triggered to do so. And they did that in response to exposure to this particulate air pollution, indoor pollution. So omega-6 fats, the bad fats, prompted more white blood cell inflammatory response upon inhalation of various air particles known to trigger asthma. The lead author of the study, Dr. Brigham, stated, "There's mounting evidence that diet, particularly omega-3 and omega-6 fatty acids, may play a role in lung health. So omega-3 fats are likely helpful in minimizing asthma severity, as our tissues convert omega-3 fats into anti-inflammatory local hormones called prostaglandin series 3 at the cellular level, whereas omega-6 fats are converted by some tissues into inflammatory local hormones or prostaglandin series 2. So good sources of omega-3 fats to concentrate on to help minimize asthma, according to this research, would be to eat more fatty fish such as mackerel, salmon, sardines, anchovies, herring, and tuna, but you shouldn't have fish more than twice a week, especially children, because of the amount of mercury that's so undetermined. We don't know how much mercury is in different fish yet exactly, so you want to guard against mercury toxicity over your lifetime. So 2 servings of fish a week. But you can also use omega-3 fat supplements, fish oil, salmon oil, or even flaxseed oil. And of course, walnuts and soybeans and soy products are also good sources of omega-3 fats. Omega-6 fats, the bad fats, are found in many common vegetable oils like mixed vegetable oils and corn oil. So it's probably better to use olive oil for salads and to saute vegetables, as olive oil is high in monounsaturated fat, which the body doesn't convert into any prostaglandin hormones. Omega-6 fats are also found at high levels in beef or red meat products, also in high-fat dairy products, homogenized milk, even 2% milk, whipped cream, ice cream, sour cream, cheese, high in omega-6 fats, and also egg yolks as well. So for individuals with asthma, paying closer attention to increasing omega-3 fat intake and limiting omega-6 fat intake may be a beneficial adjunct in the short and long-term management of this condition. So I've included the reference for this study in the text below. Thank you for watching, and I'll see you next time.